Good afternoon, everybody. Welcome to Facebook Live. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management in St. Clair County. And as always,
I'm Annette Mercatante from the St. Clair County Health Department.
There we go. All right, we'll start it off with our weekly slides here. To date this week, we've got totals, 18,346 total cases, 746 hospitalized with 410 deaths. We have 11,315 recovered, and in the last 7 days, we have seen 149 cases, and that averages about 21 cases per day. We've done 263 tests per day on a 5.8% positivity. So numbers still are coming down. And there's our ongoing chart. And like I said, you can still see we're sliding down ever so slightly, and we hope to continue that. This is our testing. It's gradually gone down the last 5 or 6 weeks. So, there's a lot to do there. Just remind everybody, if you're not feeling well, go ahead and get a test. And our vaccinations, we did pretty good this week. We were better than last week, which is all we can ask for. And with our 65 and older, we are above 70%. And with our 12 and older, we're in the mid 40s, which is okay news. We sure could be a lot higher. And then we talked about this map last week and a couple weeks ago. This is the vaccination by area, by zip code. This is an important map to show where we're doing better and where we're doing worse and can use a little more help. And then, as always, you can find our up-to-date numbers on the dashboard at stclaircounty.org/offices/health/covid19.aspx. All right, Elise, you're up.
Why don't you cover your talking points, Justin?
All right, sounds good. So, as you've heard through the news, and unless you've been under a rock for the last 2 weeks, beginning June 1st, there will no longer be any outdoor capacity limits, nor will there be any capacity limits at residential gatherings. Indoor restaurants and other establishments will now be at 50% capacity, and social gatherings will now be regulated only by the venue. Face masks will continue to be required for non-vaccinated persons indoors until July 1st, and then we will change some more rules a little bit. As far as the workplace goes, MIOSHA issued orders on May 24th for employers to reduce the risk of COVID in the workplace. The full order can be found on their website at michigan.gov/LEO. And a new hotline to answer COVID workplace questions has been established, and that number is 855-723-3219 or 855-SAFE-C19.
Okay. And so my announcement, and I'm going to change the wording because our vaccine clinics are not ending, but they are moving. So I want to make that very clear that you can still get vaccines here at the health department Monday through Thursday. You can check those appointments on our website, set up a time for yourself, and there will be other community-based vaccine opportunities as well throughout the summer. We are working with a variety of community partners to try and match up vaccine opportunities with events that are already going on. So if you're going somewhere to enjoy something that community is putting on, look around. There's very likely going to be a community vaccine clinic close by. So that's good news. And we want to especially thank our volunteers and our staff for all the amazing work. We've been at this for over 2 months, if not longer. Our first vaccine, remember, came out in early December. And the work and the support we've had from the community and our volunteers is just phenomenal. I can't thank you enough. So that's it. I think that's all I have to say. Down to our questions.
And I just have one thing to add before we get into the questions. This will be my last week being here every week. And it's been a pleasure, Doc. It's been fantastic for us to work together and get the message out to our communities. And we're not going to be too far away. If I'm ever needed, I'm able to come back. But we've gone without working on emergency management opportunities for the last year. And so I'm going to be rolling back into that role just a little bit. So thank you for being such a great partner.
Justin. And thank you for all the hard work. You've been my sidekick the whole time, and I very, very much have appreciated your expertise and what you contributed to this pandemic response is really remarkable. Thank you again.
Well, thank you. It's been my pleasure. Elise, you're up. Uh-oh, she froze.
She froze. All right.
So,
go ahead.
Go ahead.
Start with your first one.
Yep. So I'll take my question that I had from offline first. Are you guys offering or know where it is offered for the antibody test? And what I'll say is we are not, the health department is not offering any antibody tests. You can find them at places like Kroger and CVS. And there's also a complete list on scchealth.co.
Just my only recommendation is if you do get an antibody test, that you interpret it cautiously, maybe discuss it with your healthcare provider. The antibody test does not tell us when you were infected or if you are still protected with those antibodies. So please don't use the antibody test to defer vaccine. That is not, the science isn't there, and that's not what we are able to use that information for.
And Doc, I'll ask you your question so
question,
you don't have to left out. Okay, go ahead. Do you want me to ask him?
Oh, I can say it. So does the health department offer other adult vaccines as well? We continue to offer all vaccines. So when you call to schedule your vaccine here, we will continue to offer all of the vaccines that you need at that time. So please, yeah, we're open for business, and you should be coming in to get whatever vaccines you think you need. So go ahead.
Yeah, and will you be posting the number of cases in the municipalities again in your Friday updates? I found that very helpful. And that answer is yes. I think that plan is to continue to put that map in every week from here on out. And Doc, your third question, can you talk about the Pfizer and Moderna vaccines connection to myocarditis?
Yeah, so that's something that's recently come out. I have spoken many times to the very extensive surveillance system that we have in the United States that monitors for side effects and unintended consequences of our vaccines in particular. And this myocarditis issue was identified in that surveillance system with really just a handful of individuals who received the vaccine. And as of yet, there has been no connection with this event, myocarditis, which means an inflammation of the cells of your heart muscle, okay? Heart muscle cell inflammation. But myocarditis is very clearly associated. It is a known complication of viral infections, including COVID infections. So it's not a surprise that people get myocarditis. There is a basic underlying amount of myocarditis we see in the population. And so far, what's been reported is not above the level we would expect to see in general. But it is being investigated further, and we'll know more as we go. But at the very most, I could say it's exceedingly rare, rare event that's been reported. And like everything else, your risk of getting myocarditis after a real viral infection is going to be much greater than anything we might identify with the vaccine. But right now, no clear association with the vaccine, and is still being investigated.
All right, so it looks like we've lost Elise. So I'm going to be answering or asking the questions and then answering any that come my way too. So although it looks like she just popped up.
Popped up. Hi, Elise.
she won't be able to see the first couple questions, so I'll ask those.
Okay.
Laura Jean asks, how are snowbirds who got their COVID-19 vaccine in another state entered into our vaccination statistics? And we talked about that last week, Doc.
Yeah, so the answer is probably they're not. Very few of the state registry systems talk to each other. So you would want to take your vaccine card, your vaccine information to your doctor's office, or you can bring it here and we will submit it for you.
And then Bonnie asks, are numbers right for active? It seems high. And I would answer that, yes, our numbers are accurate to the best of our knowledge at this point.
Let me just comment on that, because
Sure.
now that things have come, when we were rocking and rolling a month ago, there was no way we were keeping up. And a lot of those numbers are legacy numbers. You're going to see those get cleaned up very quickly over the next week. We just talked about that this morning. So they were all active as in the last probably month, but it probably is a little elevated because we weren't able to keep up, or we were so busy with the investigation. So I would say in a week from now, things are going to stabilize and you're going to see a little bit more of a balance with that. Right? Yeah. Okay.
And then the only other two comments we had are from Kathy and Ellen thanking me. And of course, it's my pleasure to do anything that is needed in the community to help. So thank you for that. And that's it. So we don't have any other questions right now.
Oh, good. Yeah. Let me use this soapbox then for all of you that are out there, or maybe you want to share the information. The big issue in my mind is that although rates have come down, the virus is still very much with us, and those who are unvaccinated are still very much vulnerable to this infection. The impact could be the same. So we want everybody to get vaccinated, and if you're on the fence, please consider it. Get your information from a valid source. It does not cause COVID. It was not. Is turning out to be a very safe vaccine, but all the safety factors were used for the clinical trials. It works very well. It does not cause infertility problems. There's just the whole myriad of things that I'm hearing why people are not getting it. Probably the most important thing to remember is that it's not just for you, it's for the whole community. The more we have people vaccinated, the less likely we're going to go through another surge at the end of the summer or the fall, whenever it decides to rear its ugly head. So some of the models that we've looked at throughout the country, our experts certainly are modeling another rise in cases over time. And what we'd really like to see is that rise in cases be blunted because of immunity in our community, meaning vaccination. You look at our numbers of people that have been infected. We figure we know for every case there might be 3 more. It still leaves the fact that there's probably a third of the population that may have been infected, but we don't know how long their natural immunity lasts. Although some recent literature is looking very favorable with that. So we need to get those vaccination rates up. Our first goal is over 50%. And of course, our final goal will be 70%. So please consider getting vaccinated. And if you are unvaccinated, please understand, with or without a masking mandate, with or without MDHHS epidemic orders, you are vulnerable to this infection and you need to protect yourself through masking, physical distancing, and hand washing. But vaccine is still your absolute best friend, because I'll tell you, it's really nice to not have to worry about infecting other people when you go out with friends or family. So that's my spiel. We are going to, by the way, we are going to continue to be here. I will continue to be here next Thursday, same time at 3:30. And then what we will be doing is doing a Facebook Live once a month on the first Thursday of every month for the duration of the time that we're kind of calm like this. If things heat back up and get a little squirrely again, then we will definitely be back more often. Maybe we'll either drag Justin back in here as a guest host one of these times. So that's what I've said. I just want to thank everyone for tuning in.
We have a couple more questions, Doc. So the next one came from Sheila, and she says, so they are talking about boosters. I had the J&J shot and don't feel I would want their booster. Would I be able to get another booster from another manufacturer?
You know, it's really uncertain right now. My first thought is that probably yes. You would probably be able to receive a different vaccine. But we just don't have a lot of information yet about boosters, what types of boosters, why we would do a booster, what they would look like. So more to come. It's a little early for me to answer you with any real knowledgeable response.
And then Janet asks, how are the census numbers of COVID patients in the hospitals looking? And I'll answer that one. They are far lower now than they were a month ago. There's still
8%?
A couple people here and there. What's
8%.
that?
8% of the hospitalizations are COVID related.
There you go.
No, they're still in the hospital. We're still seeing deaths as well coming in, unfortunately. So that tail end is those people who are who got infected. And remember, there are still people who are getting infected right now. We're still at a very high transmission rate. Aren't we category D? Or are we in E yet? D.
No, we're D. I think we just moved down to C.
We just moved down to C, which means high transmission rate. But we're not low yet. Okay.
All right. And then Samantha asks, if someone gets vaccinated in another county like Macomb, but live in Sinclair County, will Sinclair County Health Department see it? Yes.
Yes. Yeah. Anything in Michigan, no matter where you go, if you live here, it'll show up. Your name will show up as a Sinclair County resident.
And then Sue asks, how do you know the long-term effects? And I assume she's talking about the vaccine, hasn't been out long enough.
Okay, let me talk to that a little bit, because this comes up so virtually all vaccines. So we have a long history of vaccine therapy, right? 100 years actually, but lots of vaccines, lots of time to look at vaccines. There has never been a history of a vaccine causing a long-term side effect that occurs after a long period of time. Any side effect or problem caused by a vaccine has been identified within 60 days, okay, period. So we have had plenty of time with this vaccine to look. Now, that doesn't mean that this problem, once you have it, can be long-term. It can cause lifetime effects. That's not what I'm saying. But the ability to, the problem showing up occurs within a short period of time. That's how we know it's related to the vaccine, or how we anticipate that it's related to the vaccine, because there's this temporal relationship, and then we do the studying and the research, and we find out that there's a plausible connection, and blah, blah, blah. Okay, so the idea that a vaccine or any treatment that you get today could 10 years from now cause you a problem, quite honestly, is not plausible. It's not medically plausible. It's not scientifically plausible. We just don't, we can't do that. So rest assured that after how many millions of vaccines, plus the phase 3 trials, that really minor side effects are being identified, hence the J&J thing, right? With the blood clot, that was identified very quickly. An exceptionally rare event we still were able to identify it. But the reason why we're not worried about long-term events is because, quite honestly, that's just never happened in the history of vaccine treatment. We just don't see that. And it doesn't, let me just say this too. It doesn't make sense as far as our immune system goes, because our immune system is primed to create a reaction to an immediate event. So if stimulating our immune system caused something 10 years down the line, you could see how just physiologically that would be a disaster for our bodies. So we're just not built that way. And the immune system is just not built that way. Okay.
Kathy asks, what is the percentage right now for people who are vaccinated in Sinclair County? And that number is 45.7%.
of total, right?
Of total. 12 and
Of
over.
even 12 and older, of at least
Yep.
one dose. Completely vaccinated is 39.9%, so 40%. You know, there's good data, and I don't want to discourage people from getting their second dose, but the data is starting to look really good about first doses, even doing a really good job of protecting people, even in really high-risk environments like nursing homes. So get your shot. Just even one is better than nothing.
Yeah, and I heard that number could be as high as between 24 and 81%. That's what I read yesterday. So, and
Yeah.
then Heidi asks,
So-
I got both vaccines. Oh, I'm sorry. Go ahead, Doc.
No, I saw.
You
Go
had
ahead and read it. I was just going to jump
Okay.
in and I can see it too.
I got both vaccines in May. Now I need to get my shingles shot because I had shingles last year. A nurse told me to wait a month before getting the shingles shot. What is your thought?
No, there's no longer any restrictions for vaccines. These vaccines there was at the beginning. They just didn't have enough time to look at that. But now they've said that any vaccines can be given at the same time as the COVID vaccine. So you're fine to go ahead and get that shot. Protect yourself. Shingles is nasty. Go ahead.
Shingles is
Yeah.
horrible. Yeah. So that's the last question we have. So I think I'll take a minute since you did before, and we're going to hang on till 4 o'clock if we can. But I'm going to take a minute and just kind of chat with the community too. I want to thank the community. It's been a long 15 months, and I know that our way of lives have changed quite a bit. But now we're coming into a situation where the mandates are falling, but like Doc said, there's still some sickness running around in the county. So do your very best to follow the things that you believe keep you safe. And just know that the community is behind you. We're behind you, both emergency management and the health department. And this has been a pleasure providing information so that our community could stay safe. And I thank you for your time. I thank you for being here every week to see Doc and I get on here and blubber on about all the different rule changes and everything else. It's been great, and I appreciate each and every one of you.
Ditto. So what else
All
should
right.
we talk about?
You got anything?
Wow.
Do you want to talk?
I never
do we
thought
want
we'd
to talk
come to
about?
this.
Do you want
Huh?
to talk about the MHSAA information that came out today?
I haven't had a chance to read it yet. So you want to talk about it?
Yeah, I'll talk about it a little bit. So what we know right now that came out from the MHSAA as far as high school and middle school sports is testing will continue throughout the rest of the spring season, which kind of ends here in the next 2 weeks. So right now, they're stating that once we get into fall sports, testing will no longer be required. Now, just remember, if things start ramping up and get very serious again, some of these things might change, and that's for the good of the community. But as you can see, things are kind of ramping down a little right now, which is good news for our community. But at the end of the day, just do what you can to stay safe. If you believe you've come into contact, or if you know somebody who has it or is suspected to have it, make sure you do what you need to do to stay safe.
Yeah.
The other things the MHSAA said, and I just want to read it here for a second. Give me 10 seconds.
Oh, can I just say something about testing?
Yeah, go ahead. Yep.
Well, I just want to say too that even though testing is not mandated, just like masks are not mandated, testing has been a tremendous benefit to us and has helped us control. I can't tell you how many terrible outbreaks, because a lot of people, especially young people, do get infected and not have a lot of symptoms. And the testing is the only way that you really can identify it and know to pull away from infecting other people. So if you feel like you've been exposed, you feel like there's a few people around you that are starting to get sick, testing is a good thing. The pushback has been on the mandating and making it happen. But please consider a test if you have any doubts in your mind. It's safe, It's harmless. If you don't believe the results, you can always come in here. We're still testing as well, and you can get a confirmatory test. But an early identification of a infection can be a lifesaver to a lot of people. So please don't hesitate to get tested, even if it's not required. Okay, sorry.
No, no worries. So the second point on the email was effective immediately, both indoor and outdoor out-of-season summer workouts, summer conditioning, and other summer out-of-season activities allowed by MHSAA are not required to test participants. For all summer out-of-season indoor activity, face masks shall be required for all non-vaccinated individuals. This MDHHS requirement ends on July 1st. So they will change their rules then to requiring no masks. Face masks are not required for any outdoor activity, and there is no longer a limit on outdoor crowds and gatherings as of June 1st. And that's all they have right now, and they will continue to update throughout the summer, and we'll do our best to get that out. Well, Doc, I think that's about it.
And I'll just do a quick shout out to all the community partners.
Yes.
Not just emergency management, but I saw Regina was on there. So SEC Better Together, our diversity initiative, they have done an absolutely amazing job with the Harvey Center clinics. Not to mention working together to reach out to communities that have traditionally not worked well with the health department. So I'm really excited about that relationship. We are working very nicely with the Blue Meets Green, which is an economic development group with a broad group of stakeholders, really great partners to help us move that message that, disease is bad, vaccines are good. I'll say that again. Disease is bad, vaccines are good. And trying to turn that thought process towards that direction has been really challenging, as we know. So a big shout out, SC4. Oh my gosh, who else has been great partners? CMH. Oh, I can't forget CMH. They have done a tremendous job. Deb Johnson and her team, right from the beginning, have been just super pro-vaccination. Who else? I'm going to forget somebody, and I'm just going to be...
I would like to thank our Homeland Security and Emergency Management Therapy Dog Group.
Yes. Yeah. Carolyn Crow and her team. Really great. Our board of commissioners, who really were very supportive of us, especially when we were getting into all that hot water, remember, with not enough vaccine and too many people who needed vaccine and the problems we had. So helping us solve that problem, that was very helpful with the board of commissioners. And so if I have forgotten anybody, my apologies. I'll get to you next time. Well, I can say it's taken this entire community to get to this point, and I, for one, am grateful to live here. So very happy that hopefully we'll have a nice summer, but we're not going anywhere. Promise you that.
Doc, a couple others came in, and we're going to shut it down at 4:00, but just so we can get these last two in.
Okay.
Melinda asks, can someone tell me what's going on with youth having heart swelling side effects? My 3-year-old has a heart murmur and was very sick for the first 8 months of her life. So tell me how and why she needs vaccine with these side effects now showing up. I keep to date with you and other state or CDC info.
I'm not from, I spoke on myocarditis earlier. That's all I know. I can tell you that the review of that information does not suggest there's a greater amount of this. Now, we do know that youth in particular can have a very serious complication from a COVID infection called multi-inflammatory syndrome of COVID, or MISC. And that does cause a complete body shutdown. But again, that's considered a rare complication. So as it relates to the vaccine, nothing that appears to be alarming at this time, but we will certainly keep our eyes on that and let you know as soon as something more comes up, if it comes up.
And I think that's it for questions. So I think I've already done my wrap up. So I just want to thank the entire community again for being here and listening and being a part of this for the last 15 months. And Doc, do you have anything to say?
No. Take care, everybody.
Have a great week.